Well, hello and greetings out in TV land. It's so nice to see you all. We are here doing our periodic open Q&A session. I'm Jeff Cornsair,
And I'm Allison McQuinn.
and we are so happy, as always, if you've been on one of these sessions before, if you're here live, you can type in your comments to underneath the video where you're watching this, or if you're watching this as a replay some point in the future, same thing. You can put in your comment, and we will bring that to a future session. So we do have a series of questions that were emailed in for today. So we'll work through those. We'll work through what was sent in, and as I say, if you put in your question here live, we will also get to that as well. So let me get my questions queued up here. And I am, as we are here live, I'm realizing that my computer is a little tired and it's going a little bit slow. So I click on something and then I wait, and then I go, take out my crochet or something. So anyway, so here I got the questions. So yeah, let's just jump right in. I'm going to put at least the first half of the first question up on screen here. The questioner says, what do you suggest for individuals who still have major symptoms after completing their timeline and addressing miasms? And again, I'm waiting for my computer while I click on the next half of the question. Do you usually look for something that may have been missed during treatment, or is something else usually holding the patient back from healing on the physical level? So, okay, a nice opening question, a nice little juicy question. Alison, any kind of first impressions as you see that question?
Well, I'm thinking of my own situation. I was kind of slow, I think, in the uptake. And when I went through the CM round of miasms, absolutely everything was confronting. And I, while I didn't have as many physical symptoms, my marriage came apart. I dealt with a lot of PTSD like issues after Jordan's autism was resolved and all the chronic constipation and such. It's like that round I liken to the feeling of London after being bombed out. So
Yes.
I remember the feeling, and it's interesting because I just remember when we studied, the first round of miasms was more the physical level. The
Mhm.
second was more the emotional, and the third being more the spiritual. And so, yes, there will be some physical aspects that will show up in as we go through the mental, emotional, and spiritual shifts. Also, too, I find as we go down through the miasms, diet is absolutely critical. And
Mhm.
so, yeah, I would really love to participate what the actual issues are, because yes, the individual is correct that sometimes we do have to check back and see what was missed, or is it a spiritual schism or a belief pattern that is causing the physical issues.
And as you participate in that answer, Allison, you're reminding me of something really important as well. The way this particular question was framed, and I'm not pointing my fingers at anyone. We're kind of all in this, namely that we kind of have inherited this really terrible allopathic way of thinking, myself included. Say I'm not pointing fingers at anyone. And why I'm saying that in particular is this whole definition of health and treatment and focus on symptoms. Do you have a symptom? Uh-oh, that's bad. Did you get rid of the symptom? Uh-oh, that's good. So it's reductionistic, but it's reduced things to the wrong parameter.
Mhm.
So anyway, that's sort of another way of saying that somebody can be healthy and have some kind of symptom, or someone could be, ill and unhealthy. This is a very bad state with no apparent symptoms. So they think they're healthy. Now, oh, I'm fine. I'm going through life, and I don't. Nothing bothers me. My joints don't creak, and nothing else. Nothing else is going on. But yeah, they can still be deeply sick underneath that symptomless state. And also the way you said it, Allison, is very poignant. You kind of framed it in terms of, as you went through phases of your treatment and all, and you framed it in terms of your life as a whole and relationships, and what was kind of shifting in your life, your marriage, and otherwise, which traditionally, people don't call those symptoms. Having a divorce or a separation isn't a symptom, that they would tell their doctor or anything like that. But yeah, certainly in our broader conception, we want to look at the whole functioning of the person's life force, what's going on in their life and their relationships, and how they're responding to things around them, how they're perceiving things. Because even something as what I would consider as basic as someone who has a distorted view of reality, that's not a symptom in the traditional sense, other than an extreme delusion. It becomes psychiatric, a psychiatric label or something. But no, I'm talking at a much more subtle level, where somebody, let's take our very common example, someone who exists in a worldview, an unconscious worldview, that we live in a material world, like that song from the 80s, I am a material girl and I'm living in a material world. Well, that's a very profound symptom in my books. And to most people, they don't even see that. It's not a symptom, and it's not something people would ever discuss with their doctor or whatever. But that's a profound sign of disturbed health in our way of looking at it. But as I say, it kind of falls outside of this very oversimplified definition of, do you have a symptom, usually of course meaning a physical body symptom. So as I'm not picking on the person who asked this question, I fall into this way of thinking all the time. I have to shake myself out of it and get back into reality again. But yeah, now let's get into the true sense of this question, because it's still a good question. So yes, if we get to the end of treatment, the end of someone's timeline, the end of treating their miasms, whatever is considered the end of a phase of treatment, yes, there often can and will be more to do. Kind of going deeper into certain traumas in their timeline, going deeper into some of the family miasms, and of course, what we're kind of hinting at other levels, just going deeper into their whole life. Like, how are you expressing yourself in your life? Are you living the life you're supposed to be living? Are you doing the job you're supposed to be doing? All these kinds of questions. Those aren't traditionally thought of as treatment. So, oh, I didn't give somebody a medicine, a homeopathic medicine, and I didn't change their diet. Well, how could you call that treatment? Well, that's still a remedy to tell somebody, well, I think, you have to stop, whatever it is. You have to stop kowtowing to all the demands of your boss, or doing this or whatever it is. You have to, stop being kind of someone with no boundaries, and you have to start addressing it. So anyways, I'm just making up an example on the fly here, but yeah, what does the end of treatment mean, and what does health mean? These are really this is a good question in this sense. How deeply can we answer those questions? Quite deeply, the more we unpack. But I say it's not a bad question. I just wanted to take it out of the allopathic frame and kind of get us onto a better footing there.
I remember asking my own Heilkunstler, so will there be no symptoms at the end of Heilkunst treatment? Is that what I have to look forward to? And she actually said, no. What you will have, though, is the capacity to know what to do about them when they come up. So, the thing is that you start to really understand what the world is telling you.
Yes.
And you can sift and suss out exactly what your body and mind and spirit are trying to tell you in the clearest way possible, because now you have the training. So again, just to bring up our map, as we take an individual like an onion and we peel the emotional and physical shocks and traumas off in the order in which they've assumed them, then we go through those genetic miasms, usually 3, sometimes 4, in some rarer cases 5. And then we actually will bump into really root fears and terrors called the chthonic realm. And then we get to the spiritual diseases and core beliefs. So, what we're describing with certain ways of looking at things is we've been couched very much in materialism
Hmm.
and mysticism. And with regards to these two polarities, we look at the world in a very kind of high pitched scream. It's like, well, is it this or is it that? Well, actually, it's the gray zone in between. And in the borderland where I found, my mentor had said that I was going to land in the borderland, there's discernment, there's a capacity for a sense of righteousness, there's a sense of the right work, the right partner, the right way of being, not being jam packed with so much unresolved anger and guilt, shame, resentment. And yeah, there's still some of that that I bump into and have to confront. Absolutely. But at least now I know which jurisdiction to apply. So in some cases, I need to keep my diet really clean. I can't drink coffee or eat any form of sugar whatsoever. That takes me into places where there's symptoms and, swelling and inflammation and joint pain and all the rest of it. And then, this is the jurisdiction of having peeled that onion, including the miasms. But I also, have beliefs that bring up physical symptoms. With the trauma from my own background, I sometimes become very fearful or feel unsafe. I have to work on that stuff from the inside out.
Hmm.
Sometimes it takes a remedy, most of the time not.
Yes. And yeah, thank you so much. That's very well put. The way you wrapped all that as a whole coherent set of ideas, and you reminded me something we discussed one of our podcast episodes. I forget which number, but basically the topic was on what I call literacy. But what I mean in this case, I'm talking about, like, if we're talking about the illusion that we live in a purely material world and we're purely material bodies and all of that, that's the illusion. But what we want to get to is a form of literacy where something like a symptom we can read like a word or a sentence, in a more coherent story. If we, each of us as human beings, are a phenomenon, rather than a material organism, then that phenomenal literacy is, when Allison, when you said, your practitioner said, if you have a symptom, you'll know what to do about it. This is just my footnote to that. You'll know what to do about it also includes you have the literacy to read that symptom, and therefore know what to do about it. That can mean a remedy, that can mean just interpreting something in your life, whatever the case is. But yeah, as I say, that lack of literacy, and something you just said a moment ago, Allison, is, yeah, people just do this outside in allopathic work of, is, oh, I gotta, yeah, grab a remedy and throw in a homeopathic, throw in an antibiotic. It's all this outside in. But once we become literate, we realize not only do we read the world, but in fact it's a text telling the story of us. So whatever the person who rear ends your car is not an accident. It's part of this story you can literarily read and understand something about what's happening in your life at that moment. That kind of came in unexpectedly, into your midst.
Yeah, well said. I remember when I was going through, I think it was the second or third round of miasms, and I would hit multiple Natura muriaticum walls and another clear that needed to be done at higher potencies and into LMs and all the rest of it. And I used to get so excited because I knew I was going down. It was like permission to go to bed. have a good sob and, really get into the essence of that comforting, depressed state I had spent decades in. And so I know it sounds strange, but I used to really welcome it because it felt like home. Um, and I would just kind of surrender to it. It was telling me a story that I was way too busy and that I had my foot on the gas all the time. I was living the unlived life. I wasn't in my life. I was just responding to outside stimulus and impetus. And I think that's the key. You know, it depends on the individual. Other people get to the end of the timeline first round, not a symptom lurking in the background. It's gone. They're, free to go and having just a grand romp and no other issues mentally, emotionally, spiritually. It's just like they've landed her. They don't even have air traffic controllers anymore. And that's the thing. They, in many cases, are more advanced than I am because I still have got stuff to suck the marrow through my teeth, as annoying as that is, almost 25, 30 years later.
Yeah.
Yeah, I'm just a hard case, I think.
Well, there's lots of heads around here. Yeah. Yeah. Welcome to the hard head club. Yeah. Me, you, and our dog, all
Yeah.
hard headed. Okay. So yeah, I mean that's we could certainly go more, but I think that's kind of a nice review and kind of entertaining this question into what it really implies. So let's I'll just go ahead here to this next one. What do we have? Oh yeah, this one is basically about vaccination. Do the Heilkunst remedies help the body better integrate the previously received vaccines? Do they cancel out any benefits of the vaccine or only work to eliminate the toxins and or side effects? So what do you think, Allison?
I just want to make sure I understand this question.
Oh, essentially, I can reword it. Basically, what the question is asking is when we do go clear someone's timeline, particularly they've received a vaccine, like an allopathic vaccine, on their timeline, we have that. We're giving them the homeopathic remedies
Yes.
to clear that vaccine out of their system, just like we would clear a concussion, we clear a car accident, we clear a grief, all these things on the timeline we clear. We
Yes, I
clear
know.
vaccines, we clear
But are
antibiotics.
there any benefits of the vaccine? That's what I want to understand. Because in my book,
Oh, I
it's
see.
all poison. So they're
Well,
saying, does it cancel out any
let's
benefits?
go with the presumption in this question that there is some benefit to the vaccines. That's kind of widely held view by a lot of people. Let's say we don't agree with that, but let's go with that in the question. Let's
Okay.
assume that the allopathic vaccine has a mix of benefits and side effects. That's
Yeah.
the usual story, right? And
Okay.
the usual story is that the benefits outweigh the risks. That's usually what people are told about allopathic vaccines. So in that spirit, that's what this question is asking. Those supposed benefits of the vaccine, does our Heilkunst clearing of that erase the so-called benefits?
Oh yeah,
So
I could have a romp with this if I got 2 or 3 hours to have a
two
go.
or three, just
Yeah, I
just
want.
just say 2.25, but no, but see, as I say, to the degree that there are benefits, then the answer to this question is no. The Heilkunst remedies do not neutralize those benefits.
Yeah,
they
I
they
would.
just simply detox. But
Well,
yeah,
and that.
you're right. You're basically you're reframing the question, and I agree with you that yeah, we have to seriously question that idea of benefits of the
Yeah,
vaccines.
let's
But as
talk
I say,
about.
let's start with the spirit of the question, and then we can go move out from there.
Right. So how I would answer it with a patient is I would say that allopathic medicine follows homeopathic law in two places. One are the vaccines. That's not immunization. Let's be clear. The vaccines and Ritalin, which is the street drug speed for children that suffer hyper or adults that suffer, attention deficit disorder. And that's the street drug speed for Ritalin. And then with the vaccines, you have 27 different types of adjuvants and chemicals, preservatives, and you're dealing with high potencies. So just to give a quick and dirty, autism, for example, is the system after you give the injection, there's often swelling at the site. And then you have the immune system going, "Woo, woo, woo." Then kids start lining stuff up. And, we get a lot of issues with regards to repetitive OCD behaviors. We can have seizures with regards to them. But when we cancel out or cure the underlying cause, even Dr. Molden in Canada noticed an asymmetry just in the face and the eyes. So there's always a side effect. Always, always, always. Dr. Harris Coulter talked about the result of turbo cancers as a result of all vaccines, no exception. Now, not to throw the baby out with the bathtub, as my beloved colleague Jeff wrote an article about on arcanum.ca, immunization is sound. The law of nature, like cures like, is sound. We've been immunizing babes, based on principle for 30 years. Flu doses, 30 years. Clearing the negative effects, which in my estimation is the whole ball of wax, and that you're left then with not just an elimination of toxins on the cellular level, but now the child suddenly is a piano protege, or they're painting things and saying things, and their cognitive capacities boot up beyond anything that we ever imagined. And I know because I had a vax damaged babe. So if I'm a little hot on this topic, yeah, it's because after 30 years, I've had a bit of experience with working with thousands of children and adults. And yeah, I've never in my practice had Heilkunst remedies cancel out benefits of an allopathic vaccine, because I don't believe that there are any.
Yes. Yep. Yeah, no, thank you for, yeah, you're right. You're speaking of being literate. Yeah, you read right through the question into the bigger phenomenon behind it. But yeah, as I say, I understand the spirit of the question. I wanted to start with that, but you're right, Allison. Yeah, there's kind of an elephant in the room behind that question. That's for sure.
Yeah. And the kids always called me a bull in a china shop, and I can't help that. That just is who I am. There's a lot of heat in the marrow of my bones, and yeah, something like that gets me still very fired up.
Yes.
And that's the thing, is that especially with the more recent scourge, shamdemic, plandemic, whatever you want to call it, my knowledge now is expanded, because never have we ever had such an onslaught of these poison darts than we ever have in the last 4 years. And only now adults, I think, are really understanding the nature of what they've been infected with. So you can talk about side effects, but let's talk about the blood clots and turbo cancers and issues with regards to seizures and HPV vaccines, which are based on freaking smoke and mirrors, and we have testimonials on the website that speak to the fact that we've cleared those vaccines, and now that individual's not having seizures anymore. Yeah, it's hard for me to answer it while being politically correct.
Absolutely. So I guess what I'm hearing you say is, when they say they're safe and effective, we have to cross out the word safe, the word effective, and we just end up with the word "and." That's all we can say about them.
Yeah,
And
the Rockefellers and Rothschilds, who we know teach them the curriculum at all medical schools around the world, are designed. I mean, they're known eugenicists. So yeah, as soon as I see the word benefits, my mind's just like,
Right.
actually, I don't get the question.
Right.
Because yeah. Hmm.
Yeah.
Hmm.
Yeah. Okay. No, very, very good. So thank you for all that. That's, as I say, the elephant behind the question, but that was definitely worth looking at that. So let's see, what do we have next? Oh yeah, so this question says, is each timeline event treatment akin to getting a soul retrieval? I'm referring to shamanistic traditions where the soul fragment isn't really lost, but locked away in the unconscious. Now, first of all, I'll say I don't have very much formal understanding and familiarity with shamanism. I have a vague, exposure to it, but yeah, I certainly couldn't speak authoritatively. But I do understand the sense of this question. That's for sure. Bringing the idea of this question over into our Heilkunst world and what happens in treatment. Simply, I'd start by saying yes. There is a kind of a soul retrieval. Regaining a piece of yourself that was lost. And actually, there's again, in a positive way, there's another question behind this question: why is treating the timeline important in the first place? For some people, it just seems like a weird abstract idea. Well, why do you need my timeline, and why are we treating a car accident I had 20 years ago? And it just seems so weird and abstract to a lot of people. But yeah, this question really brings it home. There is a very clear, concrete purpose. Every time we have a major shock or trauma, mental, emotional, physical, what have you, then yes, we do lose a piece of ourselves, whether that's a piece of our soul into our unconscious. We could talk about how we would actually define those terms. I don't want to be too nitpicky on that, but just this idea of losing something, and actually that's in the broader medical Heilkunst framework, the idea of suppression. As soon as somebody takes an antibiotic to suppress an infection, or whatever drug to suppress a symptom, yeah, you're losing this natural movement of our life energy, this natural life process, and you're losing it. You're kind of pushing it into a negative movement. Instead of our life force expressing itself, which is healthy, we now get a life force that tried to express itself, whether that was a symptom or so-called something bad, but that was pushed back. So yeah, we lost that fundamental soul quality of expressiveness, to put it in medical terms. And yeah, so back to the specific sense of this question. So yeah, every time we go back to the next timeline event treatment, we are now reversing that negative process that was put into place, whether medically or through a trauma, whatever it is, and now giving it back to the person so they have that ability, that capacity that they had lost in that. So yeah, we do, like, just practically speaking, we do see somebody as they go through their timeline, they just start to become more and more their true self, expressing themselves in the world, say what they really think. Of course, all their physical functions and their hormones, whatever it is, all start to function the way they're supposed to, because they're becoming more and more who they actually are at all levels. I think being able to express it. So yeah, call that a soul retrieval, or we could put it into other medical terms. It means about the same thing. But yeah, that's again a good question. And it's very real, it's very practical. We see this day in and day out of these soul retrievals right before our eyes.
Yeah. I think it's the most stunning part of being a practitioner of Heilkunst is to watch that unfolding process. I'm thinking specifically when I was still doing house calls, I went to see a little boy that I was treating for autism at the time, and he was locked away, rocking back and forth and not making eye contact, no speech, lots of issues with regards to constipation, gut issues. So the mama, she got right on board right away and started, getting off all the sugar and all the wheat out of his diet. She got him on probiotics and started to heal his gut. And it was a miraculous thing. And it was, I think, the second remedy on his timeline in. I went in, all the rocking had stopped. He was starting to speak. he was making eye contact, and he wrote his name in those blocks that have the magnets on them. They're plastic, and you stick them on the fridge. Alexander. And I just sat down, like I didn't even know what to
Yeah.
say, and it reminded me so much of unpacking my own son. I think that's what I love about the soul retrieval of children, is just, oh my God, it happens so phenomenally and so devastatingly beautiful. And to see that, just like the essence of that we being expressing himself in a way that just, I mean, was stunning to me. And
Yeah.
I was soul retrieved. I came into the system of medicine. I was diagnosed with Epstein-Barr syndrome, and they wanted to give me drugs for like MS. They called it fibromyalgia, and I was in a lot of pain. Don't get me wrong, but I certainly didn't want $15,000 worth of MS drugs a year, and I had a tumor, about an inch and a half in my left breast, so I was quite the case. And my son had been recently rehabilitated through Heilkunst out of the autism spectrum. And so I was thawed. And I remember when I did my postgrad research with Stephen Decker, he said, Ali, that's a perfect story of taking a horse to the barn that's never been to that barn before. And I thought that was a really good analogy. I had never, and still, at 60, running hills every day and just feeling the most healthy I've ever felt in my life, and living really my pure Monty and mojo, and super happy, and lots of art that I do and observe, and music, and all the rest of it, treating my beloved patients around the world. Like, how blessed I am to have been soul retrieved, because I was a freaking mess when I came in. Like, even my Heilkunst was pretty concerned I was on my way out.
Hmm.
Mhm.
I love. Thank you for all of that. I love your example of the letters for Alexander on the fridge. It's very visual and concrete, and really hits you because we can all see that the different colors of those alphabet letters. You're As you're talking about all that, I remember my own example of myself, my own soul retrieval. Back 25 some years ago, when I was going through my timeline and my treatment and all this, there was I can't remember exactly which event, it had to do with my childhood or something. I don't know what, but suddenly, like shortly after taking the remedy, I went out into my yard, and I started to teach myself. I'm about age 30 or so at this point, how to do cartwheels. I'd never done cartwheels as a child for whatever reason. It just wasn't my thing. I didn't figure it out, whatever it was. But here I was now teaching myself to do cartwheels, and like, wow, there. I didn't say this word at the moment, but that was a soul retrieval. It's like, you imagine me, speaking of a visual, like doing cartwheels along the grass. It's like, as a 30-year-old saying, "Wee!" I've never done this before. Look at me.
That's awesome.
Mhm. Okay, so actually, I'm going to put up the next question. It kind of is a good follow-up to this question, and they ask, "Do you notice that most people who go through Heilkunst treatment end up finding their unique purpose for being in the world?" Super excellent question. I definitely have things to say on that, but do you want to go first, Alison? Anything comes to your mind first?
I know what I typically observe hour after hour is that individuals will become so dissatisfied with what it is that they're doing. So I'm thinking of a woman I serve who actually is a spiritual doula counselor. She was a nurse for years and disliked it intensely because the environment were shifting so much that she felt that the environment she was working in was super toxic. And so when she changed to become a death doula, oh my gosh, it's like she came alive. And I know that sounds odd, but one of the most beautiful things to be able to observe is somebody really finding, what they're ordained to be, their true calling. And that was true for me. I mean, I was working as a financial advisor with the federal government, and I was making great money and all the rest of it. I took the summers off from April till October because that's how I define summer, to be with my kids. And that was great while the babes were little, but I was dying inside. I hated it. I hated getting on the OC Transpo bus in Ottawa every morning and heading down to those office buildings in Hull, Quebec. It was
Yeah.
like a place to go to die. Oh God, no windows open. There was no fresh air. It was freaking awful. And so, yeah, then to find myself in Heilkunst and studying and being able to help people to resolve the underlying causes of their chronic diseases is just blows my mind, the contrast.
Hmm. Yep. And yeah, again, thank you for that. Very, very good again. And yeah, this question is particularly good. I mean, it gets at a lot of the topics we've already been weaving into our discussion today, just by the happenstance of what questions are here. But yeah, this question kind of ties a lot of these things together, and we get at this really all important idea and goal that we have a very clear and true definition of health as far as this very holistic dynamic human being, not just as a material body that gets defects like a car motor or something and it has to go to the car repair place. But no, this really points to this idea of this dynamic definition of health, where we cannot begin and end with a definition of health around symptoms. We've already talked about why that is. But what this gets at is the question or the idea of how we how we express ourselves in the world, the job we do, whatever else. Can that be considered a part of our definition of health? Well, absolutely yes, because this again, could be a huge topic to go fully into this. I just kind of want to touch on some key points here, for the scope of time today. But this idea of who we are and what we're meant to do, and what is our purpose, these kinds of questions is not haphazard or random.
Yeah.
Right. Like there's no, it's like we don't just wake up, every morning and pull a number out of a hat and go do whatever that number represents. Oh, I'm a plumber today, or I'm going to do this. No, there's something is not coming from the outside in that sense, but it's coming from deep within. And it actually gets to a key term that we talk about in Heilkunst called the objective desire function. So that's already a little bit of a mouthful. What does that mean, objective desire function? Again, just to keep it a little more brief, the word desire, the root of that word comes from the original Latin, which basically means of the stars.
Mhm.
Right. So our desire, our true purpose, our who we really are, at base, is not something we just define arbitrarily. It's like we make a lot of egotistical decisions in life. Oh, I have to accomplish this goal, and I'm going to do this, but we have to ask very seriously. In this Heilkunst framework, in this health framework, where is that so-called desire coming from? Is it a true objective desire, like coming from the stars, like I just said, coming from the cosmos, or is it coming from my little ego that just thinks it needs and wants to do something, just for some kind of temporary satisfaction, momentary satisfaction? And more. I love this question so much, where I'm coming to in my practice these days and these years. This has become more and more and more concrete and clear to me of what it is, what it means, and I can actually fairly fairly clearly and fairly deeply, see it not only in myself, but in my patients. How much somebody has really recognized and activated their own objective desire function versus to what degree instead are they still kind of out in that superficial ego drive. And I'm not pointing fingers at anyone. This is a hard struggle. We're in a time of great ignorance and great lack of self-knowledge. So yeah, we by and large don't roll out of bed knowing the answer to these questions and what am I supposed to do in the world and all this. So anyway, so yes, to kind of bring it back to the sense of this question, yes, the process of Heilkunst and the remedies and all these things, even the nutrition, more and more and more awakens that objective desire function in somebody, and in fact, to the the more clear it becomes to an individual, the more difficult it becomes to hide it anymore. It's like, and there's that. I probably talked about this in another recording we did at some point, Alison. That famous the author's forward to one of his books, Paulo Coelho, when he talks about his life story, and he was working some kind of office job that wasn't really his soul's mission, but he was paying the bills and all that stuff. But he could not, essentially, he couldn't keep the job. Like he in his heart he wanted to be an author, but he just didn't feel that was practical. It's like, how am I going to pay the bills and all the usual thing? But he basically got laid off and had no choice but to follow that. So yeah, the desire function will come and bite you in the butt if you don't give it appropriate attention when you can, kind of thing. But
Well
yes, the
said.
Heilkunst process definitely raises more and more of that up and kind of moves the whole life energy to wherever it has to go.
Yeah. I pulled up aphorism 9. Can I read it?
Yeah. I was thinking of that too. Yeah.
Okay. Health is not just an absence of symptoms. This is me talking, I think, in this blog we wrote. It is a dynamic orchestration of feelings, functions, and sensations. Dr. Hahnemann illustrated it thusly in his Organon of the Medical Art as aphorism 9. In the healthy human state, the spirit-like living power, known as autocracy, enlivening the material body, the organism, as dynamis, holds sway unrestrictedly and keeps all of its parts in admirable, harmonious, and vital operation in both feelings and functions, so that our indwelling rational spirit can freely avail itself of this living, healthy instrument for the higher purposes of our existence.
Yes. Yeah, right there in Hahnemann, he gives us a definition of health, and it is a direct answer to this question.
Yeah.
Yeah, and Hahnemann was back in the 18th, 19th century, so he didn't have the benefit of career counselors and books to help you find your true meaning, but yeah, he just had enough genius to figure that out of his own life energy.
Yeah.
Okay, so where are we at here? So we're looking at which question are we on here? Okay, so the next question here. Okay, so let me just read it out and then we'll work through this. So, do the miasms interact with one another to create their own unique blended diseases? Example, if you have a patient that has a lot of the cancer and psychosis miasms, and in turn this produces kidney cancer in them, kidney problems coming from psychosis and cancer coming from cancer. Okay, so there's sort of a few issues kind of packed into this question. The first thing is, at a most basic level, we kind of have to say very simply and very clearly, yes, diseases can be compounded. Like disease, and when I use the word disease, I'm talking about Hahnemann's definition of disease. This bioenergetic impingement on our life force. Not the allopathic definition of disease, which usually gets reduced to symptoms, like we just talked about a few minutes ago. So yes, diseases are distinct entities, and they can combine with each other in the Hahnemannian sense. And in fact, this is causes a great amount of controversy with the classical homeopaths because they don't even look at Hahnemann's definition of disease in the first place. So they're often they're allopaths basically. They're often abstract. Who knows what the definition of disease is? They can't even define it. They haven't even listened to Hahnemann. But yeah, so they don't have that. They can't even go to the next step of combining the idea of combining two or more different disease entities. So yes, at the basic level, we'll start there. And what are you going to show us?
I'm just going to illustrate in case any members of the audience don't understand the nature of the question.
Yes.
So just the order of the genetic miasms: Sora, malaria, tuberculinum, ringworm. Metaurinum is psychosis. So in case you're not familiar with that term. And then carcinosin or cancer is cancer, syphilis, and then Lyme. Well, we know these are the roots for all chronic diseases in the time that we're living in. And so the overlapping qualities, absolutely. In fact, it's predominating in many cases that you see what I call the big three: metaurinum, cancer, syphilis. That state of mind can be kind of the most prevalent because it represents from the 1920s to the present. And so we're seeing, overlapping qualities mentally, emotionally, the intensity of carcinosin or cancer working its way through also with psychosis, sex, drugs, and rock and roll. You get this very individual who's got their foot on the gas pedal. They never take it off. They'll exhaust themselves and, need uppers during the day. And I mean, coffee, for example, downers, alcohol at night, or CBD oil, or everybody's taking CBD oil. That seems to be, the latest big thing. And that's the thing, is that as functions of evolution, these particular disease matrix are illustrative of what it is that we have gone through and are still going through as a function of human evolution. And so, again, just to reiterate that there's no hard line between biblical times, 300, 400 years ago, when tuberculosis featured really strongly in Ireland, England, and Scotland, for example. Metaurinum, the 1920s, sex, drug, and rock and roll, burn our bras and, make a lot of money in the mafia. And then cancer, very indicative of the 50s, 60s, 70s. Even Hahnemann 200 years ago didn't have a case of cancer to treat, really. Syphilis, and then now we're in Lyme. So the modern day hermit, pandemics where we're, told to shelter in place, close the door. That's a Lyme state of mind, by the way.
Yes.
So yes, there are no hard lines between those epochs. So there are no hard lines in the human organism either.
Mm-hmm.
It's all on the basis of resonance.
Exactly. And one, so thank you all for that. That was a good clarification. I forget. We use these words, metaurinum, psychosis, all day long, and we forget. For some people, it's their first time hearing these words. So, so thank you for catching that, Alison. But one more big clarification I want to make in the sense of this question is, I'll just go back to some of these phrases here. If you have a patient has a lot of the cancer and psychosis miasms, and in turn this produces kidney cancer in them, kidney problems coming from psychosis. So there's a bit of an untangling we have to do with this question in the first place, because it's kind of mixing different concepts that don't really go together. And what I mean is, at the one level, we can talk about chronic miasms, which is where this question kind of started from, such as cancer and psychosis, and and the implications of that. But then the question kind of, without even any punctuation or any warning, it turns into a totally different concept that doesn't actually go with that. So when it starts talking about kidney cancer, that's actually referring to the allopathic definition of cancer. So in our miasm of carcinosin or cancer, that's a whole a whole state of mind, a whole energy state of the person's physiology, which may or may not have any cysts or tumors or any of the physical definition of cancer, but is a whole physiological bioenergetic state of being. It's a state of mind. Like we talk about the state of mind of all the different remedies. The state of mind of cancer is resignation. People who kind of they're going through the motions in life, but they're back to soul retrieval. Their inner soul has been completely emptied out. Like there's no soul. It's like you almost can put your hand through the person, like there's a ghost walking through the room, and is there anybody there? Who said that? And that's the state of mind of cancer, the energy of cancer. But yeah, I say in this question, suddenly we very surprisingly take a turn from talking about these bioenergetic state of mind definitions of miasms to suddenly we're in the allopathic material definition of cancer. So we can't really put all that in one sentence and leave it as a coherent question. So as I say, not to nitpick, but back to what I said earlier, we're all kind of caught up in these residues of the this deep allopathic vocabulary and way of thinking. And even myself, as I said before, I have to work every day to remind, oh yeah, don't fall back into that. That's the wrong way of thinking. That's a language that doesn't even make sense. Those are words that don't make sense. Those are thoughts that, so it's like, yeah, I say I'm not pointing fingers at anyone, but this is the great challenge we all have, is how to even begin to have a vocabulary to have a real discussion like we're kind of fostering here. So as I say, so within this question in particular, we run into this problem of language, of vocabulary, of concepts, and it's like and it's a learning curve. I'm not pointing fingers at anyone, but just say we're all in kindergarten in the sense of coming out of what Hahnemann called the old school of allopathic medicine, and we have to come into a very new consciousness. And you don't just do that by picking up like we have a French English dictionary, whatever. You can't just quickly translate. Oh, we used to say symptom, and now we say no. You can't just do that. You have to profoundly change your thinking and your consciousness to be in this very new kind of consciousness, right? So I say not a bad question, but it's a good teaching question for getting us into the real consciousness. So to kind of maybe end up with this question, as I've kind of hinted at, a miasm, be it cancer, be it any of them, is a profoundly altered state of mind from our state of health into now it's a pathological state of mind. So as I've already said, the pathological state of mind of cancer is resignation. The lights are on, but nobody's home, as I said. So once we can start thinking of disease in that way and seeing cancer in that particular way, yes, over a long period of time, that can become what the allopath calls cancer. Oh, look, you have malignant cells, and you have a kidney, a cancer in your kidney, and it's like they talk about it in purely physical terms. Yeah, that can be an end result. That can be a symptom, like we started with one of the earlier questions. What do you mean by talking about symptoms? But yeah, that's all the allopaths could do, talk about physical symptoms. But yeah, we need to be much more have a deeper and broader grounding into what is a state of mind, what is the state of mind of health, what is the state of mind of psychosis or cancer or whatever. So once we have a deep grounding in state of mind, then we start to ask very different questions. So anyway, as I said a few moments ago, yes, you can certainly have combined miasms, combined diseases, but the real point here is, do we actually have the capacity in our discussion, in our personal developments, to actually have a real discussion about state of mind rather than a fake discussion about physical symptoms.
So, for example, Kidney Problems and Messages from the Body by Michael J. Lincoln. Just the first segment speaks to intense vulnerability, anxiety. They're suffering from a chronic primal fear with a pronounced tendency to run their life around saving for a rainy day. They're experiencing considerable anxiety, worries, and fears over money. There's no sense of well-being. and they are intensely abandonment anxious. They have no trust of partnership, commitment, or connection, and they feel alone on their own. They are the product of an intensely anxiety inducing and rejecting dysfunctional family in which much, much went wrong, over which they had no control, for which there was no solution.
Yes. Yeah, yeah, thank you for that example. Yeah, it illustrates the bigger point. We may have a symptom, but really what we have is an illustration of a deep state of mind. So, yeah, it's until you start grappling with a state of mind, we're not really talking about health.
Yeah, well said.
Mhm. So we just a little program note here. So we're just approaching the top of the hour. I mean, we have a bunch more questions, but I think what makes sense to do, Allison, I think we will go to one final question today, and we'll take the remainder questions. We'll come back here in the very near future, and we'll keep going through. The very good questions here. But as I say, for the sake of time and keeping a nice friendly framework of an hour, so all of our sponsors could get their commercial breaks in. No, we don't have any sponsors, but yeah, I say we'll do one more of the questions, but yeah, stay tuned. We'll kind of come back very soon, one of the upcoming few days or couple of weeks or so, and we will go through the rest. So I say we kind of have an abundance of questions. It's like, yeah, it's like being too rich, having too much money. It's like, yeah, we have too many good questions. So yeah, let's go to this final question, and this is actually from. Oops, clicked on the wrong button. Yeah, this question is actually from one of our live viewers. Let me bring that up. Yeah, so she asks, can muscle ligament type of stiffness, pain in my neck, nerve pain in the body be healed with the remedies? What if it's a debilitating type of pain, possibly related to emotions? Okay, I like it. Very good practical question. I'll jump right in with a little framework. I'm sure you will have something to add, Alison. But yeah, this to me again, our theme today. The question behind this question is, what is real diagnosis? What is true diagnosis? We've sort of hinted at that in another way. When we're in the realm of all the allopathic talking about symptoms, having a symptom, getting rid of a symptom, hating your symptom, taking a gun and shooting the symptom. It's like that's the allopathic framework. And I say we miss out on this deeper conversation of health. But I say to take a little step back here, what we could really begin with is, what is diagnosis? And even again in the allopathic world, you get absurd diagnosis, right? You get things like you get labels. And Hahnemann talked about this. You don't get real diagnoses. You get false labels, false condition labels. So who wants a false label when you can have the truth? We all want the truth ultimately. So yeah, so the background question to this question is, yeah, what is a real diagnosis? And I'll keep it extremely short. This is a huge topic. I'm going to say it in a very brief way. We really have three main dimensions of diagnosis. You put all those together, and now you can treat the whole case, the whole patient. But those three dimensions are what we call therapeutic regimen, which is all about balance and imbalance. That's kind of the bottom of Allison's chart she's holding up here. Does somebody have all the nutrients they need, and are they doing the right kind of exercise? And just keeping everything harmonious and balanced. And for the most part, that's what most of the natural health world focuses on. Fair enough. We need all that. We need to follow all those things. You have to do detox and all those things. But balance, that first jurisdiction only covers whatever fits into that jurisdiction. If something is coming from one of the other two jurisdictions, no amount of good diet or exercise or anything else is going to solve it, right? So anyway, so there we have part one of three of our diagnosis is regimen, as I said. Part two, jurisdiction two, is what we call therapeutic medicine. So that's where you see the middle band on Allison's chart. And that's strictly where we get into the homeopathic remedies. So we've talked about the timeline today. We've talked about the chronic miasms. We've talked, other kinds of, functional diseases. All these things that the homeopathic remedies can directly treat, and that's where we get our principle, like cures like. The law of similars of homeopathy, and we very, very specifically diagnose and treat every specific thing in that middle jurisdiction. So again, that's vast. We can talk quite a long time just on that jurisdiction as well. But again, it's not the first jurisdiction, it's not the third, it's its own unique things. You can't solve a disease in that second jurisdiction with good diet, and vice versa. You can't solve a dietary problem with a homeopathic remedy. You have to respect each jurisdiction on its own terms in its very, very specific way. So finally, as I say, I'm being very brief here, you go up into the final third jurisdiction, and now you get into the higher form, and where it can become disturbed is the function of the mind and the spirit. That's not a nutritional imbalance, not a disease anymore. Now we're in that realm of the mind and the spirit, and illusions and delusion, like what I talked about earlier, that delusion of materialism, that's a spiritual disease, basically. That's coming from that third jurisdiction. Many people have that these days. But now when we have those three jurisdictions, I'll kind of bring it back home to this very concrete question is to answer it, first of all, it has to be answered on an individual basis, really taking the whole history of one person. We can't just answer it for, oh yeah, for all the people with these allopathic labels, this is going to be the answer. No. There's a unique answer for each person based on the unique breakdown of those three jurisdictions for that person. Where are all the imbalances? What are all the diseases? What are all the spiritual delusions? Like I just mentioned, you put all that together, and now you cure these false condition labels, as Hahnemann would call them. That's the only way to do it.
Yeah.
On an individual basis and on a three-tiered, three-jurisdiction basis. So
The
anyway,
first question I would want to ask her is who is being a pain in her neck,
yeah,
right? And then find out it doesn't even need a remedy then in the traditional sense. If we can figure out what is the cause, it may just be a dose of truth that she needs, is that she's in a relationship that's causing chronic pain in her neck, or she's carrying an enormous amount of burden on
yes,
her shoulders. Shoulders is, carrying responsibility. And how long has that been? And what's the nature of that? In some cases, we're able to just treat it with the third jurisdiction of Heilkunst medicine,
yes,
and she doesn't even need, a dropper bottle, mother tincture, or
mhm,
timeline event, for example.
exactly.
Mm-hmm.
Yeah, you're right. Sometimes it's just a pure, simple thing from one of the jurisdictions, and that solves the whole thing. Other
Yeah.
times, it'll take, you kind of have to stack all of the different therapeutics to kind of untangle all the knots that are behind that. So, yeah, again, very individual, and we would have to treat it, as always, as a very individual question. So thank you all. As I said, we will come back around, in very, very short order, and we will go through the rest of the great questions that came in. Yeah, otherwise, you can keep putting any further questions into the comment box. We will get to those as well. We'll keep working through, um, one question after another, and we keep having our great conversations. But yeah, any kind of general theme, Alison, you want to comment on where we've gone, what we've talked about today, or any impressions you've come away with?
Well, I've been studying a lot about the Romantic um, era and how the system of medicine has come really out of the Romantic era, where we never separated our human nature from nature. And that means that really to rely more and more on your internal compass. What
Yeah.
feels right? What is the right choice for you? How can you boot up more your ontological or sense of individuality to make choices from the inside out. How can you feel more secure and confident to be able to provide that state of grace to yourself? So, again, just I'm really ruminating on that more and more, is that it's time to trade in kind of the cancer state of mind of the false authority telling us what to do. A lot of us went to state-based or, government schools where, yeah, don't think for yourself, just do what you're told. Nah. Actually, it's really time and super important at this juncture to actually fully step in and burn off those old diatribes, and really listen and express who and what you are in the purest, cleanest sense, and retrieve your soul. Allow yourself the full Monty and expression of your essential self and who
Yeah.
you are ordained to be from the inside out.
Beautiful way of wrapping up and summarizing a lot of what we said and the definition of health and who you are. Yeah, live it from the inside out, and don't get all caught up out there on the trappings of that so-called outer world. Like it's real, but yeah, it's, as I said earlier, it's just like literacy. And can you read that outer world so that, yeah, you can live in the way Allison is saying, from the inside out. So keep everyone with us. Keep your eyes on your inbox. We will announce a time for a follow-up to today, our part 2. And thank you all for your questions. Thank you all for being here. And we will see you soon.
Yeah, we so appreciate you and your questions. So thank you so much for spontaneously giving us this opportunity to have this discussion and dialogue. Super important.
Yep. Okay.
Adios, muchachos.